Do you think that the larger role for telehealth that we're seeing because of the pandemic, do you think that will remain after the pandemic has ended?
Yes, I do. And I think people are going to scratch their heads about what they're going to do with their facilities to some extent. Yes, I truly think that this is something that will change the way we practice forever. It won't necessarily replace that one-on-one and great hands-on experience. And there are ways, of course, that you can't avoid it. But I think for instance, in post-operative care, I don't think anybody's going to, unless they're having complications, nobody's going to want to drive 30 miles, wait 30 minutes, have a 2-minute visit to have somebody take off your bandage and look at your wound. You can do that with a camera. You can do that talking. You can find out how they're eating, their bowels are moving, and all that stuff. I think that that will become part and parcel to it. And I think that docs, once they realize this is convenient for them, this works, it doesn't change my global payment or my per visit payment, and therefore I can sustain my practice, I can keep my employees, they can still have their roles that they play. And I see that not changing dramatically, but I do see this changing the face of how we provide care significantly. And then there are, once again, those other extensions. I've always advocated for three-way consults. When I have a patient in my office who either has an established or an uncertain kind of medical complication that's maybe out of my bailiwick, out of my expertise. And so I need to bring in a neurologist to talk about the seizure they might have observed last night in their child, or a gastroenterologist to say, where do we go now, and at what point do we need to do an endoscopy or something of that nature. These are things that I think need to be done in a more convenient fashion rather than a sequence of appointments and waits.